Head and neck cancer refers to a group of cancers that arise in the tissues of the head and neck region. This includes cancers of the oral cavity, throat, pharynx, voice box, larynx, nasal cavity, sinuses, and salivary glands. Types of head and neck cancer. Oral cavity cancer includes cancers of the lips, gums, tongue, the floor of the mouth, and the roof of the mouth palate. Oropharyngeal cancer involves cancers of the part of the throat pharynx that is located at the back of the mouth, including the tonsils and soft palate. Laryngeal cancer affects the larynx voice box, which is located in the throat. Nasopharyngeal cancer occurs in the nasopharynx, the upper part of the throat behind the nose. Paranasal sinus cancer involves the sinuses, which are air-filled spaces around the nose. Salivary gland cancer includes cancers that originate in the salivary glands, which produce saliva. Risk factors. Several factors can increase the risk of developing head and neck cancer. Tobacco use. Smoking or chewing tobacco is a major risk factor. Alcohol consumption. Excessive alcohol use can increase the risk, especially when combined with tobacco use. Human papilloma virus (HPV). Certain strains of HPV, particularly HPV-16, are associated with oropharyngeal cancers. Chewing betel quid. A common practice in some parts of Asia that involves chewing a mixture of betel leaf, arecanut, and slaked lime. Poor oral hygiene. Chronic irritation from dental issues or ill-fitting dentures may contribute to risk. Family history. The family history of head and neck cancers or other cancers may increase risk. Exposure to certain chemicals. Occupational exposure to certain chemicals or substances, such as asbestos, may increase risk. Symptoms. Symptoms of head and neck cancer can vary depending on the specific area affected but may include oral cavity cancer, persistent mouth sores or ulcers, pain or difficulty swallowing, red or white patches inside the mouth, loose teeth or pharyngeal cancer, sore throat that doesn't go away, difficulty swallowing, ear pain, a lump in the neck, laryngeal cancer, hoarseness or changes in voice, persistent sore throat, difficulty breathing or swallowing, a lump or mass in the throat, nasopharyngeal cancer, nasal congestion or bleeding, earaches or hearing loss, swollen lymph nodes in the neck, headaches, paranasal sinus cancer, nasal obstruction or bleeding, facial pain or swelling, vision changes, persistent sinus infection, salivary gland cancer, swelling or a lump in the mouth or jaw, pain in the affected area, numbness or weakness in the face, difficulty swallowing or opening the mouth. Diagnosis. Diagnosis typically involves medical history and physical examination. A thorough examination of the head, neck, and oral cavity. Imaging tests. CT scans, to view the extent of the cancer and its spread. MRI scans, to get detailed images of soft tissues. PET scans, to detect cancer spread. Biopsy. The sample of tissue is taken from the affected area and examined for cancer cells. Endoscopy. A thin, flexible tube with a camera is inserted through the nose, mouth, or throat to visualize and biopsy suspicious areas. Treatment. Treatment for head and neck cancer depends on the type, location, stage, and overall health of the patient. Common treatment options include surgery, removal of the tumor and surrounding tissue. Reconstructive surgery may be needed to restore function and appearance. Radiation therapy. Use of high-energy radiation to kill cancer cells or shrink tumors. Often used for cancers that are localized or as an adjuvant to surgery. Chemotherapy. Use of drugs to kill cancer cells or shrink tumors. It may be used in combination with radiation or as a primary treatment for more advanced cancers. Targeted therapy. Drugs that specifically target cancer cells for their growth pathways, often with fewer side effects than traditional chemotherapy. Immunotherapy. Treatments that help the body's immune system recognize and fight cancer cells. Prevention. Preventive measures to reduce the risk of head and neck cancer include Avoid tobacco and alcohol. Quit smoking and limit alcohol consumption. HPV vaccination. Vaccination against HPV can reduce the risk of HPV-related cancers, particularly oropharyngeal cancer. Good oral hygiene. Maintain regular dental check UPS and good oral health. Protective measures. Avoid exposure to known carcinogens and practice safety measures if exposed to harmful substances. Healthy lifestyle. Eat a balanced diet rich in fruits and vegetables, and stay hydrated. Conclusion: head and neck cancer encompasses various types of cancers affecting the head and neck region. Early detection and treatment are crucial for improving outcomes. If you experience symptoms or have risk factors, consulting healthcare provider for evaluation and appropriate management is important.